Hi everybody, Leslie Manukian of Health Freedom Defense Fund here. Just to tell you a couple things, actually to share a good laugh with you because something hilarious did happen today. And that is that FDA approved a medical product created by Pfizer. That's what happened today. And it's hilarious because, let's see, that product's been on the market for 8 or 10 months under emergency use authorization. And today they said, full approval, it's totally safe. You can trust it. And it's going to convert all of you hesitant people to get it. That's what they said. This is what the Washington Post headline actually said. Pfizer product wins FDA approval, potentially persuading the product hesitant to get it. Of course, it didn't say product. I put that in there just so that I could maybe avoid the YouTube censors. Anyway, it's hilarious. It's like they think that Americans don't know what's really going on. They don't know that FDA is the same organization that approved OxyContin. How many people has that killed? What about Vioxx? Estimates are it killed tens of thousands of people. Some estimates are 500,000 people. FDA approved. Come on, it's totally safe. Go out and get it. Everything's cool. You're just a little hesitant. Get over it. Or I guess they think that people are just ignorant to the fact that 600,000 people have reported adverse events following this product to the government database for these kinds of products. Or the 80,000 serious injuries or 13,000 deaths that have come after these products as well. I mean, it's farcical. You know, we're just supposed to trust them now that they've produced, that they've rubber stamped it. But let's be honest, we all know what's really going on. They've made a mockery out of public health agencies. That's what they're doing. You know, I think most Americans understand what's really happening, and that is because it's everywhere. Just yesterday, I was down at a farm and I met this young woman, and she's about 40 years old, and she went on a hike recently after getting her medical product, and she passed out. And she's been having heart problems ever since she got her medical product. Isn't that interesting? But of course, it's all a coincidence and it's silly. And if you don't want to go and subject yourself to that, you're hesitant. I mean, come on. The stories are everywhere. FDA rubber stamped this product, but people know what's really going on. And you know, another really interesting part of this whole thing that is actually laughable as well is that they didn't have a public health hearing. There was no opportunity for doctors or scientists to comment or to say what they really thought, which suggests that FDA didn't want the public to see what thousands of doctors and scientists have to say about these medical products and the fact that they are injuring and killing so many people. The fact that this is still going on when the swine flu product was taken off the market after 50 people were killed is all the evidence you need that this isn't about your health, right? Let's be honest. This is about something completely different. I'm not saying what it is because I'm not 100% sure of that, but it's not about my health. That's for darn sure. And the fact that the pharmaceutical industry pays over 60% of the drug approvers' salaries at FDA tells you whose side it's on. Not mine and yours. That's for darn sure. Literally, over 60% of their salaries come from user fees by the pharmaceutical industry. And let's be honest, that same pharmaceutical industry also spends $3–4 billion a year on digital advertisements and other advertisements. They own the media, which is why the media is nothing more than a megaphone for the industry. So you've got the public health agency protecting your health, right. And then you've got the pharmaceutical industry paying off the media, and there's almost no way that Americans can get the truth except through independent outlets like Health Freedom Defense and others on the internet, and by talking to their neighbors and finding out the truth that, hey, you know what? A high school girl in our school where my son just graduated just had a heart attack after this medical product. Let's be clear, all these people have done is made a mockery of public health agencies. That's what they've done. And you know what? They deserve our ridicule more than anything else. So I hope you'll all join me in giving them a hand. Yes, applauding them because they've at least given us a good laugh today. Thanks a bunch. Talk to you soon. Bye-bye.